Okay, so you guys are able to see the sandbox training on COVaxON here? Yeah, I guess I can't. I'm sorry. Okay, so this is how you would this is how we start off with the client. If you have a healthcare card number, this is where you would be entering it. So you're going to put their healthcare card number. Let's see, you would search a client this way. This is how we search for clients. It's just quickly put in their healthcare card number. As you can see, it's not listed on here. For the healthcare card. Another way to search for your client, you can also use this one. So if they don't have a healthcare card number, or they don't have it on them, or they don't know what it is, you can just search for their name. So say their name is like Apple Tree. So then you would put that in there, and then it would show up on here all the listings under Apple Tree. So then you would just confirm that it is their chart, like what's your birthday, and it says over there, and then you can confirm by the phone number. If for some reason you cannot find them by their first or last name, you can also try by their phone number. If that doesn't help, then you can also try their email or address, whatever you would search up here for any of those things. Their first, their names, phone numbers, and emails. And then once you're able to find them, or if you cannot find them, or if they're a new client and have never had a vaccine, then you're going to want to create a chart for them. And then I'll pass it over to Dell, and she'll show you how to create a chart.
Hi, everybody. Thanks for joining our training this afternoon. My name is Adele, and I'm an RPN working in COVID. So I'm going to walk you through quickly how to create a client chart. So we're going to go to client search. And like Melanie said, if you can't search the client, so we're going to put in the health card number. So usually a health card number is 10 digits. So for training purposes, we're starting with a 0. And so we'll search the health card number. And so they have a client already created with that one. Okay, let's try another one. Okay, so this is what's going to come up, like Melanie walked through if you can't find it. So after you confirm that there is no client with that health card number in the computer, we are going to go to create new client. And again, this is for an Ontario resident, for somebody that does have an Ontario health card. So when you're creating a client chart, there's mandatory fields that we have to fill out. So we are going to fill out a first name, a middle name, a last name, as well as a health card number, date of birth, their gender. There are asterisks next to the field that needs to be required as well. And over here, we'll enter the Windsor-Essex Public Health Unit as well for our health unit. And we fill in the vaccination event, which you can confirm with your lead to see what your event name will be. We always ask the client as well who their primary care provider is to add that to their file as well. And we go to reason for immunization, which for anyone over the age of 6 years old, we do age eligible population majority of the time, unless there is a child or an infant who is attending a school or daycare, then we can choose that and we can search for their institution as well and add that to their chart. At the bottom for the contact information, we will take the mobile number and home phone number if that's applicable. I know not everybody has a landline these days. We'll also take their email address that allows them to receive the QR code after their immunization is complete. We fill in the proxy name for any child that is accompanied with their parent for their immunization appointment, or if we have, let's say, an elderly person or someone who's unable to make decisions for themselves that has a POA or SDM, we will also add that in here as well. And their address information. This also pulls from the Google addresses, so once you start typing, it'll auto-populate their postal code and everything. So that's nice. And at the bottom, so there's 2 very important fields here that we need to make sure that are checked off. So number 1, most important, is the consent for data collection. So this is them giving us consent to create their profile in the COVax system. If you ever have a client who for some reason refuses to have their information in the computer, we do have a paper copy that we can fill out their immunization information and provide them the receipt for today's dose. Just check with your lead and we can provide you that paperwork. But honestly, in 2 years of immunizing in COVID, I've maybe had to do that once or twice, only a handful of times. And the second most important thing down here that we need to check off is the follow-up communication by email. So this has to be checked off in order for them to receive the link to access their QR code. If for some reason this wasn't checked off or they didn't consent for follow-up communication by email, they can still access their QR code on the ministry website just by searching Enhanced Vaccine Certificate on Google as well. These are all just research communications. If you want to ask your client if they would like to participate in any further research or communication, you can check that off as well. So once we create the new client, I'm just going to pull up a client here. So this is the main page of everyone's profile. So top left, we have their age, how many doses they've had administered. These, again, are all the mandatory fields that need to be filled out. They have age-eligible population for the normal adult, the vaccination event for this particular health unit. They did not fill in a primary care provider. Maybe they don't have one. Mobile number. Maybe perhaps they don't have an email. Sometimes our elderly population doesn't have an email, and that's okay. And their address here. So if we are creating a file, let's say for someone who is a non-Ontario resident, so someone that lives out of province or out of country, so we will click on health card number unavailable, and we can also search just to make sure they're not in the computer. So let's just say Smith, and there's no one, so we'll go to finish and create new client. So you will go through again all those mandatory fields, but without using the health card number, we will choose an alternative ID. So typically we use driver's license, or if someone has a passport from another country, permanent Canadian resident card or other. And we also take down the alternative ID number just in case they come back and there's a discrepancy with the identification or something, we can verify it by the document number. So either the driver's license number or their passport number. Okay, and that's all I have for creating a client chart. So I'm going to turn it over to Cassandra for clinical notes and alerts.
Hi, everybody. So again, this is that main page for a client once you've searched them. In the details section, it doesn't matter if you're in related, details, client immunizations, which this shows their previous immunizations. Clinic notes is up here in this section. And if you need to make a clinical note, say client passed or fainted, you had to intervene, say you took their blood pressure, what have you, then you would document that clinical note in there. Click new. This is just your heading. Just for example, if they fainting, we'll say episode. And then you would complete your documentation here, your time that you checked for blood pressure, what it was, and your intervention and how they were post-faint. Okay, so I'm going to cancel that. You would proceed to click save at that point. Another option is the other one that I'm going to discuss is alerts. So this would be used as a warning, perhaps for safety, like for example, verbally aggressive client, or if a client has submitted a fraudulent OOP, perhaps. Again, you would click new. Warning, say it was a fraudulent OOP. Click next.
What's an OOP?
Sorry, out of province vaccination that was submitted. My apologies.
Thank you.
You're welcome. Thank you for the question. Alert name would be, you could say fraudulent OOP or out of province. And then you would write your comments. Client told to seek proper COVID vaccination and told to come back to the health unit or whatever the situation is. Comments and then save. Right now, I'm going to cancel that and your notes would show up right here. Maybe I'll do just a quick demonstration. You'll be able to see it generated a clinical note ID. You could go into that clinical note and see your note right there. You could always go back to the main page and you're back right on that same page that we were first on. And I'm going to pass you on to Melanie to discuss the immunization document.
Hi, okay, so I'll show you how to do a new immunization. So once you've determined that the client is eligible for a vaccine, you're going to want to click onto new immunization. And then administer point of service. You might see another thing here that says historical. You don't have to worry about that for now. And then you're going to go into vaccination event. You're going to make sure that you click on the right one. So you'll have like a choice on there. And yeah, so use Northwestern there. And then you're going to go to the next. You're going to select your vaccine. So so this is at the point where we look at our syringe and make sure that it matches the numbers on there before you pick it. So make sure it matches the lot number. So if you're going to go with Moderna, you click onto Moderna, you're going to go to next. So this will pop up if, say, it's too early for them to have a vaccine. So it'll be like, are you sure you want to administer? It's been to this many days. So let's just say that it has been enough days. So you would just go hit the next button. And then it'll take you to the administered point of service. So you're going to want to make sure that you have clicked the information has been reviewed. You're going to click the pre-assessment has been completed. There's going to be, if you have a child that you're vaccinating, there's going to be like, if you click on this one here where it says I am consenting, you're going to click that and then you're going to fill in the parent's name, their phone number, and the relationship, if it's a parent or a POA or anything like that. And then let's take it out there. And then you would pick which site that you're using. See the left deltoid, or you can pick whatever site you're using. Left deltoid. So this one here for dosage administered, this is going to be important for the Moderna infant. Usually, is it this one here? Or is it? You're going to have to remember to click down to, it's a little drop sheet, and you would, if it's an infant Moderna, you would change the dose to 0.25. It usually says 0.5. But you would make sure that you do that, and then you're gonna go down. And then this is just where you type in the immunizer's name or the nurse's name, and then the reason for immunization, usually it's the age eligible is what we've been using, but like Adele was saying, you can, if you do child and youth, you can just,
excuse me.
you can just put in the institution's name and that'll fill up, and then you're gonna hit finish. I'm not sure if it'll let me do it. See it. Well, it won't let me go past it. But once you hit finish, it'll automatically generate a receipt unless they do not have an email. If you do not have an email, sometimes you have to go back there and you have to generate the receipt yourself. So let's say they don't have an email, an elderly, they don't have an email or anything, it won't automatically generate a receipt. You're going to have to manually do it. Did you guys see that? So you're going to have to go back to, go to client immunizations. You're going to click on the last immunization that you just gave them. You're going to click on that number there. And then you're just going to generate that receipt. And then this will take you to, yeah, so it says it's generated, and then you're just going to put next, and then you're going to put finish. And then that should generate the receipt. And then usually we reprint with our iPad, and I'll take you to, and Adele will explain that real quick and how to do that.
Okay, so we don't have the iPad to show you guys how exactly to do the print process, but I'm going to show you on the laptop. So like Melanie just showed you guys, if we have somebody who doesn't have an email, we have to generate the receipt here. So where we find the receipt is we're going to go back to the client's homepage and we'll go to related. Under related, there's a files tab here. So this is showing today, September 26, 2023, the dose administered receipt, and it'll load the preview. So this is showing that this client, sorry, this is from September 21st. She generated the receipt. Okay. So this is the receipt that we will print everyone as a proof of immunization. We usually, when we hand clients their receipt, we just confirm their name is correct, their date of birth is correct, that they received the right product, so that we make sure there's no discrepancies at the end of the clinic, and that we confirm their dose number of their running total. And lastly, we go over the time down here at the bottom. This is their 15-minute post-observation period. It is a standard. Unless someone has an anaphylactic allergy, then we keep them for 30 minutes. So how we print this receipt is we go to download. If you don't download the receipt, you will print like a toilet paper roll of receipt paper. So make sure you hit download, and then we open it on the iPad. And like you would kind of on the laptop, you go to File and Print. And this allows us to print our tiny receipt paper. Also, for a lot of people that are coming with the out-of-province vaccines, after we sign off on their immunization, I do have them just double check their email to make sure that they did receive the QR code, just to avoid them going home and not coming back to us saying, hey, I didn't receive my QR certificate, and we can figure out that problem before they leave the clinic, rather than to have them come back and it be a hassle for them. So I think that's all we have for you today. We will